All right, we're back. Personal Healthcare Reform Talk Show on Pegasus Net Waves, taking your health to a higher level. And today, I have the president with me. Okay? Seriously, I have the president with me. So we're going to do a State of the Health of the Union today on this show. Not State of the Union, the State of the Health of the Union on the show today. So stand by. The president will be here today. Okay? This is a must-listen-to show. Okay? So before we get going here, ClintFuquay.com. That's right, little old me has the president here. And ClintFuquay.com, ClintSpurgeons.com, PersonalHealthCareReform.com. Hashtags LiveLean2016 and my new one, hashtag Make America Healthy Again. And, of course, find everything on Facebook, Twitter, Instagram, Pinterest, LinkedIn, Google+. All this is on my websites as well. Also, YouTube. YouTube for tons of videos. I've got like 200 videos on there, people. Spreaker with all the old shows. Yes, I'm updating those right now as we speak. Well, not quite as we speak, but actually, yeah, as you're listening to this, I probably will be. And then, of course, SoundCloud as well. And then Idea Fit, see all my past experience for health and wellness and stuff. Articles. I got a brand new article coming out in Men's Fitness. Check that out. Coming up, probably going to be August or September on that one. Rocks Digital, I do articles there. Offbeat Business, brand new article in there as well every month for them. In fact, I will be on the Offbeat Business show in August, so check that out. And definitely check out that show here on Pegasus. And Living the Dream magazine is back, so I'll be back in there doing some inspirational writing for everybody for health and wellness. So there's that. Let's get into the health partners right quick because I got the president here, so I got to whip through this first part very, very quickly. So Human, helping unite mankind in nutrition. Once again, it's all the snack foods that you need for the office, all organic, non-GMO, healthy stuff. That way you can have your goldfish and eat them too, and be healthy. MedCall Pro, once again, they'll be in here very soon. We're going to talk about what they're doing in telemedicine, having your doctor on the phone, anyone in the world. Awesome program for companies and individuals that they're rolling out right now. Ultra Labs, lab testing, 2,500 locations all across the U.S. Okay, once again, Make America Healthy Again. Go in there, 20 to 80% off all testing. Whether it's a swab or it's blood testing, whatever you need to get done, don't have to wait on the doctor, don't have to wait on the hospital. You set your day, your time, your tests, you go in, you get it done, they send you the report back, you take it to your doctor, show it to your doctor, that way you are informed and you can be independently healthy, okay? Everlywell, also, if you don't want to go someplace, stay at your home. They'll send this stuff to you, okay? They have 2 tests up right now, it's just a pinprick or a swab, okay? They're not having to do the whole blood draw, that's why they can do the in-home testing like they do. So you prick your finger, send it in. They send results. The results are gorgeous. It's very, very, very incredibly easy to read. Okay, you're not looking at stats and numbers and stuff. They have graphs and charts, and it's pretty and everything. Awesome. I'll have them in here as well very soon. Kinesi, of course, I'm wearing my Kinesi right now. Awesome stuff. Get ready. New show with them coming up in October, November. We're going to discuss the entire brand new product line, clothing line from them. All kinds of cool stuff from that company coming out. Once again, Active Cotton, you can't get it anywhere else. Okay, Thrive Market. Instead of going out to the show or going out to the store and wasting time going up and down the aisles trying to find good stuff for you, they have everything there for you. If you're paleo, if you're vegan, if you're non-GMO, whatever you want to do in your diet, they got it right there. You plug it in, they give you a full listing. And remember the last show I talked about the Avo Mayo? It's there, okay? Avocado Mayo. Seriously, it's awesome. And then, of course, last but not least, ID Life. Once again, go take that health assessment. It will save your life, quite literally. And I do want to reiterate, this is the only thing that you can take to your doctor and get covered by insurance that it's a nutritional supplement, because we give you all the information. It's they can't deny it. Okay, they can't deny you. They can't deny coverage. It's phenomenal system. Check it out. This is actually step 2. If you go to ClintFuquay.com, it's step number 2 on the process. Okay. A couple of things about events coming up on 7/14. That is actually this Thursday. So while you're listening to this show, we will have already done the ribbon cutting over at PhysioFit. And then on 16th, come out, which is on Saturday, come out and have join us for the 3-year anniversary party. Okay, we're gonna have live DJ, we're gonna have music, we're gonna have food, we're gonna have drinks, we're gonna have all kinds of stuff out there. Come out, check out PhysioFit, and see why I partner with them and why I'm helping put together the corporate wellness program too. Okay, And then, of course, on November 5th, American Diabetes Association North Texas, Step Out Walk. If you'd like to be a part of this, please be a part of this. We're looking for sponsors, of course. We're looking for teams. Join up, be a team captain, get some people out there walking. Once again, let's make America healthy again, and part of that is reducing diabetes across the U.S. And the type 2 and prediabetes, that we can really, really easily control. So let's get out there and get walking, okay? Health and news, hot list, because I just got a couple minutes, so we're going to bang through these right quick, because once again, President's coming. EWG sunscreen list, best and worst. They've added 150 products, okay? Because there's tons of products on the market. Most of them are junk. They will actually get you sick, okay? So EWG.org, go check them out. It's also on the Facebook page. Best and worst sunscreens. Of course, don't use the worst. Use the best. Invest in it, okay? Great stuff. Obesity is a killer and sugar is a weapon. This is from Dr. Samadi. Of course, once again, if this is Monday, it'd be Man Crush Monday. I love this guy. He is absolutely phenomenal guy. I find him on Fox News Channel Sunday mornings on House Call. Excellent show. The doctors on there are absolutely phenomenal. Great information from them every week. I highly suggest you watch that. But great info from him on that. Gallstones for women. Women have gallstone issues 2 times more often than men. Okay, probably due to stress, probably due to diet and everything else. Great segment on that. Anatomy of the Death Stick. This is from Medical Daily. This is a whole breakdown of what's in a cigarette, okay, and why you should never pick one up or put one in your mouth or breathe it, okay? So, great thing on that. Smoking, please just stop doing that. It's time. Dangers of Ambien and sleep meds. This is from the Huffington Post. Great video on that, talking about Ambien and how it affects your system. Basically, how it makes you sleep through life, and is highly addictive as well. So the sooner you can get away from it, the better. Truth in Media. Okay, I've posted part 4, Profiting on Death. Part 1, part 2, part 3, all awesome. Part 4, phenomenal. This is from Ben Swan. Incredible series. This guy, I love the information he puts out. Definitely check his stuff out. The entire Truth Media series that he does. Diabetic wounds. Major great information there from the American Diabetes Association that's on the page. Get uninhibited and go move. This once again is from Dr. Samadi. This is tons of tips on how to get out and go moving. Part of them. Go shopping. Go get you some new workout clothes. You do that. Guess what? You can go. You want to show them off and go work out, right? Find a group. Go work out in a group. Maybe you don't like groups. Do it in privacy of your home, on your own home, okay? There's all kinds of apps and stuff out there. I've got one of them, by the way, ID Wellness. You should check it out. We actually will put together a workout program specifically for you on that, and get a plan. Pokemon Go. Okay. This bit of insanity. Everybody's going Pokemad with this thing. I saw a great meme. It's doing more for health and obesity than anything, including Michelle Obama in the past 8 years. I loved it. Yeah, it was hilarious. Anyway, yes, I did share it. I posted it because what's it doing is getting everybody, especially the kids, up and moving about. Okay, just don't do it at 2 a.m. because bad things happen at 2 a.m. whenever you go hunting Pokemons. Somebody else will be hunting you. Okay, there's news stories about that as well. But if you do it, go out, have fun, go chase some Pokemons. Got to catch them all. Okay, go catch them, and run around while you're doing it. And last but not least, before we get into the show, Fort Worth is now going to be leading the nation in reducing medical errors. They actually brought in Christopher Hart from North Texas National Travel Safety Board. They deal with plane wrecks. Okay. Because this is the number 2 killer in the U.S. 250,000 people a year die because of medical errors. Okay, costs us over $50 billion. It's huge. The more we can reduce this, guess what? The better off everybody is. So, if you're worried about death by doctor is really pretty high. Okay, or medical error anyway. So Fort Worth is going to try to help start ending this whole issue of medical errors because it's a communication issue. So there's that. Come back for the rest of the show. Like I said, I've got the president on here today. I have the president. It's awesome. It's State of the Health of the Union. Come back, listen to the show. Go check out clintfuqua.com. Take my 4 steps to health, okay? Go through them. Step 1, Step 2, Step 3, Step 4. That's how easy it is, okay? And literally, it is that easy, okay? Go in there, check it out. Hashtag LiveLean2016. Let's help me make America healthy again. And the push-ups are coming back, by the way. So, I'm still doing stuff with 22 Kill as well. So the push-ups are coming back. It's going to be round 3 very soon. And definitely come back. You're going to love this show today. It's a must listen. Oh, yeah. One last thing. Buy my book, Personal Healthcare Reform. That's right. I've got a book. It's been out for 3 years. You should check it out. It's a great book. Come back. Listen in. State of the Health of the Union with the President. All right, we're back. Personal Healthcare Reform Talk Show on Pegasus Net Waves, and hail to the chief. The president is here. Seriously, the president's here. Sorry, I'm cracking up. So the president is flying in town today, but I have a different president with me. I've got John Cheneler from. He is the president of EHN, Executive Healthcare Network, which I go to this meeting every month, and so I figured since we're going to do the State of the Health of the Union today, I'd have you in here to talk about the state of the health of the union and talk about what's going on within the health industry, medical industry, and insurance industry, because that's what gets talked about every month at EHN. And people need to know what's really going on, what the numbers are, and some hope for the future of how we're going to do this whole thing of what I talked about in the first part of the show, which is make America healthy again, because that is the goal. So before we get going here. If you'll enlighten everybody a little bit about you, your background, what you've done in the medical industry, your years in the industry if you want to. We're not going to throw the age out there. And then also a little bit about what EHN is before we get into this whole thing.
Thanks, Clint. I am John Cheneler, and I am the president of EHN. I'm also the compliance officer of GGA. And we are a worldwide compliance organization that specializes in compliance and audits for hospitals and medical companies. And I've been in the medical industry for about 3 decades, and the last 10 years in the compliance arena, working in primarily the hospital side of the compliance function. Now, as far as EHN is a group of about, we're at almost 1,200 members. And it is primarily vice presidents and above, medical doctors. As you indicated, you attend meetings. We have open meetings once a month where we have speakers and we discuss health-related issues. And it's an opportunity for each of us to share what we're doing in healthcare and develop a camaraderie with each other. A typical meeting will have 75 to 100 people, and we'll have 12 meetings a year, open meetings for members and their guests, to update each other on what's going on. We might one month talk about hospitals, and the next month talk about medical delivery, the next month elements. So that's the story of EHN. And as I mentioned, we've been around about 10 years, and we have international speakers, government speakers that come in, and private speakers that come and educate all of us.
Because you've got people from everywhere. You've had Parkland, you've had Health and Human Services in there, literally one of the top people at Health and Human Services in there 1 month. The information is it's incredible, the information that's put out there. And it's non-biased. It's just, here's what it is. Here's the info. Here's what's going on in our piece of the industry. Here's what's going on in our hospital. Here's what's going on within the government. Here's the raw info. Do with it what you will, somewhat.
And you're a classic example of that. You spoke not long ago and gave us ideas on, okay, now you've learned what's happening in medicine and the management of medicine. How do we actually stay healthier? Everybody talks about it. Let's get some meat and potatoes and dig into this and figure out what can we do.
Oh, yeah, and I got to say, my panel was phenomenal, too. That panel I had up there did a great job.
You did a wonderful job.
I stood up there and looked pretty. That's all I did. Here's
pretty much
mic.
what I do.
Yeah. So let's get into a little bit of what's going on here in the U.S. Specifically, let's look at just the general state of health within the United States. What's going on? How healthy or how not healthy are we? Because numbers get thrown around, but what are some of the realities?
The reality is we've never been healthier than we are today, and we've never paid more for it. And the dilemma is we've not found a way to accomplish what we want in healthcare and reduce the cost as low as they were 30, 40 years ago when we weren't as healthy and the life expectancy wasn't what it is today. So we're in a balancing act right now. We've got tremendous advances in medicine. Cancer, for example, used to be such a severe death sentence. Now it's almost becoming treatable. Precautionary areas of medicine. We're able to treat each other much better from a medical standpoint. Unfortunately, the costs have skyrocketed. And the population is growing in the United States. The demographics are changing. Where people live, the demographics of the country. The World Health Organization estimates that we have approximately 321 million residents of the United States. The total GDP spent on healthcare is 17.1%, some of the highest of any modernized nation in the world. It's in the United States. But I've said many times, if we didn't want to spend that, we wouldn't spend that. Now, we're also spending almost $10,000 per person per year on healthcare. And statistically, in 1996, we were spending $3,700 per year. So the cost is going up. It's the old adage, nothing is free and there is no free lunch. Yeah. And that's what we're seeing in healthcare.
Yeah, we talked about this a little bit before the show, which is, we're on the front of the spear. We're on the front end, being that we are the U.S. and we kind of innovate most everything, and so is Israel quite often. But we put most of the investment in on everything. If something new comes out, it probably came from us. We invested hundreds of millions in it, if not more, into this new thing. We test it, we try it out here, work out all the kinks, and then guess what? The rest of the world gets to use it for pennies on the dollar for what we invested, which is why healthcare costs are less other places because, well, they're not the ones that are innovating most of the time. They're just they're getting to ride on our coattails of the innovation and using it for little to nothing.
Yes. To buttress what you're saying, in 2015, the FDA approved 45 new drugs. The FDA invested 125 new employees to help speed the process of getting the drugs through the market. In the month of June, 127 devices were approved by the FDA. These are new drugs, new devices, and you're correct, Clint, we lead the world. Nobody comes even close to the amount of products and devices that we're bringing into the market. And some of them are widespread, disease-oriented, or surgical procedures. Some of them are very niche-oriented or orphan drugs. And what we have done in the United States is we're not treating just the very, very sick and the high revenue diseases where you have tens of millions of patients. We're treating all of the patients in the research side. And we're investing in this, and we're building this. We're also investing in the United States in the medical education. Contrary to what the media would tell you, we're educating more doctors today than we ever have. Approximately 20,000 students in the next 2 to 3 weeks will get their obligatory white coat, the first event they get as a first-year medical student. That's 20,000. In the state of Texas, there'll be almost 1,700. In 2003, it was 1,150. So you can see we are educating more doctors. We're realizing that the demand is there, especially in the state of Texas. We've really bumped up our education for medical doctors here.
Yeah, well, I know there's been kind of a catch-up thing, which is we're falling behind on it, so we got to get recruitment up and get more people into the medical industry, and it's starting to catch up.
Yes.
and catch up with the upswing. Of course, there's a lot more people that are coming into the U.S. and everything else, kind of like coming into Texas. The massive amount of people moving into Texas right now from everywhere, of course, is increasing the need for doctors, nurses, medical staff of all different types because we have half of New York and L.A. and everybody else moving here.
Yes, yes, we see it. And especially we see it in healthcare. When somebody comes to a new area, one of the first things they do is look for, where do I go to get healthcare? And we haven't yet migrated as a society to the urgent care model. We're still in the mindset that we were in the 70s, that we want one family care individual that shepherds all of our care for us.
Yep. As opposed to being much more mindful, taking care of a lot of our own care, knowing what's going on. So we can be an advisor for ourselves in some cases, along with the doctor, whoever we're working with at that point in time, because they know what's going on at this point in time right now, and not an entire vast history of what we've had. So they're playing catch up. So help them out, help them help you, basically.
Well, we have a ways to go, but at least we've made the attempt to begin to address some of these problems, especially in Texas. In Texas, we're probably addressing it at a faster pace than some of the other states where I visit those states, and they're really behind the curve on trying to find a way. Yes, we have problems here with Medicare, Medicaid funding, but the bottom line is, no matter who you are, if you go into an emergency room in the state of Texas, you'll be treated.
Yeah, there was a story in D Magazine, or actually D Health, for Fort Worth leading the nation in reducing medical errors.
Yes.
Which is awesome, phenomenal article. By the way, go read that article, everybody. Talking about the issue with medical errors, and it is a communication issue from all different sides. A lot of times it's a communication from the patient to the doctor about stuff, because if you haven't watched Dr. House, I love Dr. House. That show, one of his main caveats is patients lie. They don't want to tell you everything. They want to give you just enough to get themselves in and out of the door. So, open up with your doctor. It helps. If you don't tell them everything that's going on, you don't tell them everything that you're taking, bad interactions happen.
Clint, a lot of people don't realize we have more hospitals in the state of Texas than any other state in the country, by far. And we became oriented toward the electronic health record system long before it became part of the ACA. So we're at about the 10th year of the electronic healthcare record system. So I would expect that we would start to address the medical error problem at a faster pace here than some of the other states. And we're seeing it through the record keeping more than anything, because it's electronic. It's not uncommon to go into any hospital in the state of Texas and see everybody in the hospital with some type of an electronic device recording what's going on.
Yep, which helps out tremendously. This way, chicken scratch is not good.
Yeah,
it cuts down on that.
Yes.
And so, that's. It's good to know that since we are here in Texas, we are, quite literally, we're kind of leading the way in everything, including medicine and in healthcare and everything else. Speaking of that, specifically, we touched on the medical industry. We know the state of the medical industry here in Texas is doing very well. What's the general state of the medical industry nationally?
On a national scope, the hospitals are consolidating. And we're seeing a shifting in the hospital from the large hospitals to a smaller hospital model. The hospitals are starting to see that the majority of their revenues are from outpatients as opposed to bed patients. That's a drastic shift in the mindset of how the hospital's going to deliver. In many communities, and especially in Texas, we see the urgent care facilities. So it's very easy to access medical care when you have an initial concern for yourself. We're leading the country in that. In the Midwest, they're doing a good job of that. On the East Coast, they're a little behind on that. But we're starting to see the shift away from the large hospital being the sole provider of the medical source. The patients are becoming much more educated, and patients are starting to figure some things out. I'm often asked, what's your opinion about all the ads on TV? Doesn't that increase the cost? There's a cost to educating people. Some of the times the ads are telling people what is available on the products. So there's always a plus and a minus to everything, but the patients are getting more information. They're taking ownership of themselves. And we're starting to see that more and more. On the West Coast, it's about what it is in Texas. On the East Coast, it's lagging. The Midwest is doing a phenomenal job, and a lot of that has to do with the medical centers and how they perceive their marketplace, and they push themselves out into the marketplace and become very active in the marketplace. One of the downsides to what we've seen over the last decade is about 1,400 hospitals are no longer in business. So they have closed up. We're also seeing that the for-profit hospitals, of which there are very few, most of them are nonprofit hospitals or state-sponsored. The for-profit hospitals are run much more efficiently than the non-for-profit or the state entities. A lot of it has to do with what the type of patients are that you're treating, but we're starting to see much more on the efficiency model as we've migrated into value-based medicine.
Yeah, because most of them they have to pay their bills. They can't get an infusion, from tax monies and stuff like that a lot of the times. So if they don't make their bills, they don't make their bills, and then they're out. I know one thing you hit on this, the emergency care model and all the smaller emergency care facilities all over. A lot of those are starting to be taken over by Texas Health Resources and Park and everybody else, because they know the more they can get out into the communities and have community-based health, the easier it is to take care of everybody, as opposed to everybody coming to the hospital en masse. You got multiple units all over the place people can go to. Doctors are there, and it keeps everybody from going to the hospitals and increasing costs there.
A couple of years ago, Children's Hospital was a pioneer in that, and they purposely went out and built their own centers for people to take their kids to, as opposed to the emergency room, and they found they were more efficient and the patient got better care. And to your point, now some of the larger hospital groups are looking at those urgent facilities and acquiring them because it's a more efficient model for the patient.
Yep. All right, very good. Thanks for coming out. I wanted to hit the health of the insurance industry, but I think we already know what the health of that is. For the most part, it's if you haven't seen the news, watch some of the news on rates of everything and all the consolidation there. Any closing thoughts, and then contact information for yourself, and then EHN.
I would say that we have nothing to fear in the healthcare industry today. We're in an explosion of new products and new therapies and new treatments. We've never seen the quality that we are seeing today. It's a wonderful time if you need healthcare in the United States, and we lead the world. As an example, if a woman has breast cancer, she has a much better chance of surviving in the United States than any place else in the world. Our medical care is first rate, and we're in a great direction. We're going through changes, as you indicated. The insurance industry is going through some changes, and we're all going to have to adapt to it, but mainly we have to take control of our own health care.
All right. Thanks. Anything for EHN?
EHN, if somebody's interested in looking up information, I ask them to look us up on LinkedIn and send information through there if you're interested. It is a private organization. You need to be healthcare oriented to be involved, but the way to find us is through the LinkedIn website.
All right. Thank you for coming on. Once again, I've had the president on the show today from EHN, and for State of the Health of the Union. Come back for the next show. Once again, more great stuff coming from us in the future here.